for the invitation. I would talk about another modality of that is the wide-angle imaging for the pediatrics patients, and especially very useful for the infants. And of course, this has been there for quite some time. The problem is still an expensive tool, but very, very useful. So basically, I think as far as the pediatric imaging is concerned, this is considered a gold standard, and you have basically two kinds of RAT cams. One is a RAT cam shuttle, which at present we have, and the RAT cam 3, where you have additional facility that you can do fundus fluorescein angiography. You have a lot of lenses here. We can't go to 200, but we can go to something like 130-degree maximum. But you have other lenses also if you need to concentrate on an area under more magnification, like you can have a 800 or maybe like for NTS segment as well as for angiography. Basically, I think this has been a great tool as far as the ROP screening and management is concerned. And the second is for the retinoblastoma. Also for the juvenile glaucoma, I think the problem, we don't see shaken baby syndromes, and that it's a common problem in Western world. And of course, doing a fundus fluorescein angiography, which was almost impossible in infants, and some of the NTS segment other indications. I think this has been the best telemedicine device for ROP screening, that is the remote screening, done by not ophthalmologists, by the technician, nurses, and then that's how it has been used. I think at this time, what is being talked more and more is a universal eye screening in the newborn. I think that's where it is coming as a great tool. And so the detection as well as the documentation of everything, the congenital, inflammatory, degenerative, and mass lesion is possible here. So I think it's a great tool. And of course, I think most of the clinics anywhere where they have a busy retinoblastoma clinics, they have this tool. And so here you can again have a digital records. You can document the progression as well as the regression and consult anywhere. You can send the image. You can send it to Shield. You can send anywhere. So that's the advantage. So as I said, this is a standard of care even for retinoblastoma. Usually it would be in most of the OR. In fact, 80% of the top ranked US pediatric hospitals, they have a RAT cam as far as the management is concerned. I think it has been a great tool for telescreening of retinopathy of prematurity. It will give you a instant documentation. As I already said, it's a very quick exam, although it's a contact method, and you can remotely send the image and get it diagnosed from an expert. So that's the best thing. You can permanently store these images. So I think a lot of things are possible. You know, interpretation is not easy as far as the ROP is concerned. We make mistakes. That's how it is such a great device that you can send it to an expert and identify the treatables, because we have a very narrow window as far as the ROP is concerned for treatment. So that's how probably if you can take a wide angle picture, it's a great tool. I think now Dr. Anand Venekar, who spent a lot of time with us in PGI 6 years, has become synonymous with telescreening anywhere in the world. I think he has the largest sort of a now at this time database. He has first time tried this, taking one machine to various places even in the rural areas, and he has reported sensitivity and specificity of something like 95-93%. And so this is a great tool. Not only that, I would like to mention here there's something already in the offering, this machine being very expensive, where he is involved. I think it is with the Forest here being demonstrated, which is going to be very cheap. I think you can get like 120 degrees. So we'll have great things coming as far as this modality is concerned. Maybe that is the way probably the retinopathy of prematurity and some of these, as I said, universal eye screening would be done for infants or children even anywhere, which is not possible in our country. Yes. So you can exactly see the pre-plus and plus disease, document, even look at the progression, and you can exactly, if you take this kind of a picture, my antenna or anybody who's going to look at it is up, that there's a very serious disease going on. And you might even take anterior segment picture like this, where you have so much of vessel, that means the disease behind is very, very severe. And this kind of a picture, you see here, this baby in fact was 2 kgs. And look at, this is the aggressive posterior ROP in zone 1, very severe. So I think it's a great tool. You can just document it. You don't want to wait here, you want to straight away take for treatment. I think when we were not having this rat cam, these are some of the pictures which Michael Shapiro had given to me. I think he had shown nicely. This is in 2002 he has taken, and you can see the progression. Just in a week's time, how much it has progressed. And it has further progressed in even next 2 days. Then treated with confident laser, and he has shown the beautiful regression. So that is what the beauty is. So, and one of the other cases where there is already a 4A retinal detachment which has developed. So this is from our collection later on, once we got, you have this baby here, and you can see how much plus disease is there, dilatation, tortuosity, and that is what you want to see. Now look at, after, this is just after 2 weeks, these vessels have straightened up. There is no dilatation, tortuosity. So that is what you gain, and that is what you get, and that's what you would like to see. This is another one, again fairly severe disease. You can see these vessels, they straighten up, they are no more dilated. And so this is a picture which Anand has taken. He has taken this montage right up to the ora serrata. He has taken the whole thing here. So you can even create a montage like this, and you may have sequelae which might happen like this, or infants are coming late. And this was the famous Avastin, New England Journal of Medicine, from Miss Hittner, and she could show this progression and how the vessels are growing on angiography on rat cam. And these pictures were given to me by, this is a very smart lady from Mexico, and she did a lot of angiography, and you can see how well you can look at the CNP area, demarcation line, leakages, shunt vessels. I think she has shown variety of things happening after injection of Avastin. Even she has shown something like some kind of these shunt vessels developing, and also the leak, which don't, you look at the OCT, doesn't show. But she has shown that even after Avastin you might have a leakage like that developing in the macular area. So lot many things are possible, and this is a great tool. And of course you may not have ROP, but a retinal hemorrhage, or this like bilateral cherry red spot in one of the storage disorders, and some kind of a mesos phenomena which you can capture on a congenital stationary blindness. So it's a great tool. You have better documentation, visualization, easy to use, early detection, and a great educational tool. Above all, that is where you can convince, not only for the resident, for the patient, for your colleagues, but for the patients, to convince them. You see, it's a very difficult disease, but once you tell them, they would be ready. The problem is it's a contact device, you have to put it on the, that is a little bit of a disadvantage. Sometimes you might have, due to small pupil, poor quality image in 15 to 20%, and of course sometimes you may overestimate because of these reasons, ROP. Otherwise it might be at time a challenge if the pupil is not dilating well to look at the extreme periphery. So RATCAM is a great tool. I think we're going to have devices which are going to be much cheaper. This is going to be the way, I can tell you, which will go to these sick newborn units which are being opened up in every district of India by Government of India under NHRM. So that is where we are going to have a challenge, and all of you would see floods of ROP cases coming. And it helps to identify stage of ROP. The retinoblastoma, as I said, we have picked up retinoblastoma. I didn't even see that. They took a image and there was a retinoblastoma. We were screening for ROP. And follow-up and monitoring of all treated children of various diseases is possible here. And you can do a very good angiogram, as I have already demonstrated, if you have RATCAM 3, which at present we are trying to acquire for our center also. Thank you very much.